Hi everyone, I am Dr. Osman Ahmad, and today in collaboration with the NGO Malaysians Against Hepatitis C, or better known as MyEx-Hep-C, we'll be sharing some information on hepatitis C. Hepatitis C is an inflammation of the liver which is caused by the hepatitis C virus and can further be divided into an acute or chronic infection. It can range from a mild illness lasting from a few days to a few weeks or to a more serious lifelong illness. Hepatitis C is one of the most prevalent liver disease in our country. Based on last year's statistic, about 500,000 Malaysians were estimated to have hepatitis C, but only about 74% were known to have active infection. Hepatitis C is known to be a blood-borne infection, whereby the transmission is even through a small quantities of blood which is infected with this virus. Therefore, risk factors include intravenous drug users, tattooing, transfusion of blood products, sexual transmission, and from mother to baby during pregnancy. It is important to note that hepatitis C cannot be transmitted through breast milk, food, water, or by casual contact such as hugging, kissing, and sharing food or drinks with an infected person. Many people are unaware that they are infected because they are often asymptomatic and therefore this disease is left undiagnosed. Nonetheless, common symptoms that patients may present with include fever, fatigue, joint or muscle pain, abdominal pain, nausea, vomiting, loss of appetite, and jaundice. Complications of hepatitis C include liver cirrhosis, which is permanent scarring of the liver tissue. This can lead to further life-threatening complications such as liver failure, altered mental status, and also an increased risk of liver cancer. Early detection and treatment is vital because delaying the treatment can lead to an increase in healthcare costs and also more serious complications. A simple and affordable blood test can be done to diagnose this disease, and this test is available in most hospitals. The good news is that hepatitis C is curable almost up to 95% with treatment, unlike hepatitis B and HIV. With such measures of accessibility to hepatitis C treatment at an affordable price, Malaysia has received the Leadership Award in Intellectual Property and access to medicines. As Malaysians, we are extremely fortunate to have access to healthcare benefits at just a fraction of the cost. Yes, please come in. Hi Mr. John, have a seat. How can I help you today?
Good morning, doctor. I came today to get my blood test results. Are they ready?
Sure, give me a moment. Let me just have a check. Yes, Mr. John, your results are ready, but unfortunately I have some bad news.
Why, doctor? What is it?
The results indicate that you have a disease which we call hepatitis C.
What does that mean, doctor?
Hepatitis C is a liver disease which causes inflammation of the liver tissue. The good news is that with full course treatment, you have a good chance of full recovery.
Doctor, is the treatment very expensive because I may not be able to afford it?
If you don't mind me asking, Mr. John, are you a Malaysian citizen?
Yes, doctor, I am.
Oh, then you're very fortunate because our government has actually subsidized the cost of treatment by more than 99%, and it will only cost you about 500 ringgit for the full course treatment.
Thank you very much, doctor. I feel much relief now.
No problem at all, Mr. John. Here's a pamphlet for you to know more about hepatitis C. Remember, prevention is better than cure. Please pass the message.
Thank you, doctor.
No problem.
Hey John!
Hey Ben, how are you? Long time no see.
It's so good to see you.
Good to see you too. Join me?
Sure. Hey John, how's your week?
Well, Ben, sad to say it's been a really tough week for me personally. I just got from the hospital yesterday and the doctor told me that I have hepatitis C.
Bro, I'm so sorry to hear that.
It's actually very common for people in Malaysia to have hepatitis C. They may have the disease but did not present with any symptoms. Thus, they go untested and undiagnosed. The doctor gave me a pamphlet and I read about it. That tattooing is a huge risk factor for hepatitis C. Did you know about it?
What? Are you serious?
Yes, Ben. However, don't worry. You should go and get yourself tested immediately. There's a simple and affordable blood test available in most hospitals in Malaysia.
You know what? I think I should go and get tested right away.
That's a great idea. Here, have this pamphlet and read more about hepatitis C. And don't forget to pass the message to people you care about.
Hey there everyone! Prevention is better than cure. Now that you know more about hepatitis C, it is advisable to get yourself tested immediately. A simple act of passing the message from a doctor to a patient to a friend is a primary preventive measure which has been proven to be effective in saving lives and a lot of time and money. Health promotion and disease prevention through education is important in raising public awareness. Do your part to make this world a better place to live in. So, don't forget to tell someone you care about what you know about hepatitis C today. Remember, pass the message.